I'm gonna wipe it off, get all the hair off, stuff like that. So then scrub, alcohol. All right, so always start with your scrub first. So your surgical scrub first, because you want to end with alcohol. Okay, so you take your first one. You're doing aseptic. I visualize, so I usually do it generally in the middle towards, or a little bit towards the bottom, because if anything happened where I didn't get that catheter in, I have to move up. So I got to remember that. So I start a little bit towards middle, towards the bottom. So then I visualize, and I'll do just one quick swoop around with my surgical scrub, one quick scrub with my alcohol. See, I remember. I'll do another one with scrub, alcohol, and it's that quick. One more scrub, so I'll come around, and then alcohol. Always make sure you're finishing with alcohol, okay? So now it's surgically scrubbed.
So then a total of 3 each?
Mm-hmm. Yep, 3 each. That's what you should be doing. I know every clinic is different, at least if you're doing it once.
You
gotta remember.
Unless it's a dirty scrub. The dirty scrub, just clean the best you can first.
Yep. So, of course, so it's all scrubbed. Don't try and touch it. You can stabilize it, but don't try and touch that vein, okay? Because that's where you're going to be introducing that needle to. And if you don't scrub, like I said, it can introduce a lot of bacteria, and that's what we want to prevent. All right, so I'm opening my catheter here. So what I like to do with my catheter is I like to push it up and down, because sometimes they can get caught. And so this will loosen it up when I have to push it in. Another thing too is they have a catheter cap on here. I'll sometimes loosen this, because sometimes I'll lose it, sometimes I won't, depending on how fast they are bleeding. But a little bit more air in there will help the flash come up faster. All right. So I like to set it next to my patient. Don't let the needle expose, so always do it with it in the cap. I open my cap, because then it'll be ready when I need to grab it. All right, so try and be sterile with this. Don't touch the end of this. I'll set it on my vet wrap to get that ready. I got my tape already, so I have my 3 pieces of tape. So which one will go first?
The small one.
Yep, the smaller one. So that'll be the first one. So all scrubbed, ready to go. I totally don't do that, but I have to touch it. I'm hoping this goes through. All right, so then I'm gonna place my catheter. All right, so I'm ready. I have all of my stuff out. Got my flush there, my cap. So now I'm going to place the catheter. So sitting here, just like you would with a needle, but you can actually hold it comfortably. Make sure you have one finger free, because you actually have to slide it on. All right. So what I'll do is I'll advance in. Once I get a flash, someone push that. Oh, it's coming out because of all the stuff. All right, so unfortunately with these legs, it's not that great. So I'm just gonna pretend, let's say I saw a flash of blood. So once I see a flash of blood, stop advancing. Stop advancing the needle. Then you are going to push the catheter in, okay? All right, so I pushed it in. I'm going to have my restrainer at that time is not occluding anymore once I get it in. So then I hold this off. I keep the needle in there for a second. I make sure that I can grab my cap really quick, because depending on the size, sometimes too, what I'll do is if I'm really not confident, I know he's gonna bleed all over, I'll actually put gauze under here, right? And then I occlude right here. Or your restrainer, sometimes if they're a really good restrainer and you know, you're all thumbs that day and you need to use both your hands, occlude at the catheter. It's not gonna hurt them, because when you press on it, it's a catheter, it's rubber catheter. Not gonna do any damage. So you quickly put it out, make sure, and then you put it on. All right, and then you make sure it's in tight. So your restrainer, this is your restrainer. Your restrainer needs to do good. It needs to make sure, all right? So now my cap is on. Make sure it's tight, so tighten it tight. And then I like to hold it with thumb, because then I grab it back onto my patient's leg and I have control of that leg. So I'll take my gauze out. My first piece of tape up, sticky side up. You go under here, make sure you're not going too far with your catheter because you can break it this way or it can pull out. So as much as you can do. So you're gonna go right under that catheter, okay? So sticky side up, always have a extra piece here. And then you're gonna flip it over. Make sure it's on the catheter first, okay? And then when you come back over, cover that end of the catheter. You need to make sure that this end is there, okay? Now, I'm gonna take my bigger piece, and if I had a T-port, I would do something different. But I'll take my bigger piece, and now I have my notch in it, right? We're gonna come up here and we're gonna make it snug in there, okay? So get it up there. Make sure that's all up there. Unfortunately, the stuff isn't taped, but then you're gonna come around. Don't make it too hard, but don't make it light, okay? This will come around and you're gonna come up all the way to that cap. Never tape the cap in though, because if you need to take this off, you can take it off and replace it if you have to. All right. So that is my catheter. Now, if I had a T-port in here, I would do an additional tape. So let's say, pretend this is a T-port. I only need half of this. So I rip that in half. And something like I call breast cancer awareness. So it's kind of, you twist it, and then what you would do if I had the T-port, let's say the T-port was right here, you would put it like the T-port and do like a breast cancer awareness. Like that, like the T-port, because then the T-port won't come out. And then I would do an additional tape around here to keep that ribbon in. So make sure you're tapping both of these. Okay? So that's with the T-port. But other than that, if we don't have a T-port, we only have injection caps. We can get away with 2 pieces of tape for now. And if you really, like before the big step, if you're really not comfortable with that tape job, you can take the 1 long tape and tape it at the base of the catheter all the way around to guarantee that'll stay in and it'll give it a little bit more stick. So that's where if I had to use 3 pieces of tape. All right, so now what I like to do is I'll check it. So we're gonna check it. So I'll push a little in first and then I pull back. I have to see a flash of blood, okay? If you don't see a flash of blood or you're getting negative pressure, you're not in at all. So then we have to start over. And then I'll flush half a syringe and then save it. Once I know that it's in place, so when you're doing that, when you're checking, either your restrainer should check, but always up by the elbow, you can feel IV injections. So they lightly would put their finger over that vein to see if they feel something going through, which more than likely they can. Or what you can do is you can do it too. You can do it right. Don't do it over here because that's where the catheter is. You're gonna think you're in the vein, but you don't know. So that's why you have to go further up.
So if you, when you're flushing, if you pull out and you don't see blood and you have to redo the catheter, would you do it in a different leg?
No, I would try this leg again.
Same leg, okay.
I always try the leg again because if anything else happened and I need the other leg for something during an emergency, that's what.
So you get 2 pokes, isn't it?
Yep, I would do 2 pokes.
Okay.
Do you go higher then?
Yep, always higher then.
Okay.
Because anything under that is gonna leak through that hole or it's gonna be clotted because
You're
it's starting.
restarting too.
Right.
You're just starting
Yep.
the whole process.
Yep, and that's why you do a pretty big area.
So I said like 1 to 2 inch.
And then once I'm done, you can do this a couple different ways. Sometimes I'll just put it around here because I can still see it. Or if I really want to be fancy, I can put a hole in this. Like I'll do it for euthanasias. I will make it really nice, and then make sure my injection port But always make sure that you have access to your injection port.
And should that also be tight enough, but not too tight?
Mm-hmm. Yep, anytime. Yep, anytime. And you'll feel it. So I have access to my catheter this way. All right, and then always get rid of your sharps. Be careful with your sharps because usually catheters will end up all over.
Mm-hmm.
Any questions or concerns about placing an IV catheter? Because I want everyone to do it and show me. We're gonna practice. Unfortunately, I only have 2 of these arms. Do you have any other?
We have the black
We can
one.
do.